been helping us break down this intersection.
Mm-hmm.
And as we move towards like digital health services, the any online places, like it's a marketplace, unfortunately, anywhere you go, it'll be ads on ads on ads. How do we then navigate in an ethical way, having digital health services and also marketing them in a way that's ethical and not like, hey, buy this painkiller, it's the best one
Mm.
yet, in a weird way.
Mm-hmm.
That's actually an interesting question. And in my day to day work life, I actually always say that ad- advertising healthcare is very different. It's like basically telling the patient, I need you to get sick so you can get healthcare,
Mm-hmm.
or I want you to get sick so we can get money, or something of that sort, which is not the type of trajectory we'd want, especially when you're in healthcare. So, as patients increasingly embrace health solutions, marketing strategies will need to adapt to effectively communicate the value of these innovations. And the emphasis is basically to ensure that patients can get the best information about their health.
Mm-hmm.
They can control their health in a way that they can be active participants in their healthcare journey. And in this way, what we can do in this way is basically show patients that they can take the preventive approach.
Yeah.
Being able to get the illness or catch an illness before it gets worse, or being able to go for a pap smear for women or for a prostate check for men just before anything happens, or just being alert about their healthcare in general. So rather than looking at it from an ad perspective of buy painkillers, do this, do that, go for the preventive approach so you can reduce on all that burden of healing diseases only when you have them, rather than catching them before they actually affect you.
That's super exciting. I have my own personal questions about that. Maybe I'll ask you off air. But of course, there's inspiring examples of patients, of one or more patients' journeys. But we'd like to just share one in particular of how your company profoundly transformed through technology. Some of the patients have actually gained a good experience. So we'd like to just know of a story of one person who maybe used that kind of technology that improved their lives.
I'd probably not specifically single out one person. I'd talk about this from a holistic perspective, because we have this wellness and chronic disease management program that's really successful for patients. So we've seen that it's helped patients get better health outcomes. The idea of it is, for example, let's say patient A called Spencer comes for our wellness check, and we're able to tell from that wellness check, is this person prone to chronic disease? Do they actually have it, or are they prone to it? And what are the measures that we can take to, I guess, combat that, or to help them live a better life? In this way, we've seen that, for example, the patient comes, gets a wellness check. After that, they're able to, let's say they have a chronic disease, so they join our chronic disease management program. In this way, we're able to follow up with their care, ensure that they're getting the right diet, right treatment, the follow-up that they need. They're actually like coming to the doctor at the right time, and we follow up with them until they're able to manage their own healthcare journey in their own way. Or if they need extra help, we come in where they need that extra help. But at the same time, it's just following the patient along their chronic disease journey, rather than them having to come every single time to get checked, to get checked, to get checked, to get checked. When they feel like they have a small issue, we already know what the issue, we've caught it. And so from that way, we can be able to guide them to make better decisions, better life decisions, get more information about whatever is affecting them, and make informed decisions about what to do with their health. So this is one of the things I think we have not had, and it reduces hospitalizations as well, because you are actually there taking care of your health, rather than only meeting it when you're sick, like I mentioned. So
Yeah.
I think this is one of the best things that has happened. And of course, all the records are online. There's nothing that's paperwork, and everything is actually there for you to see. You can actually get all your patient records online, and you can keep understanding what exactly you need to do to get better by like getting it accessible to you.
I love the emphasis on proactivity when it comes to health. Like you've mentioned, yeah, it's getting ahead of the situation, knowing that you have the chronic disease before you have to treat it, at an advanced level, for example, or just being preventative about these things. We'll close up the conversation in a minute with perhaps a few tips in here and there, but we've got some Ice Spice with Munch coming your way, and then we'll take a look at the roads. She, by the way, was your winner for Rookie Artist of the Year at the Billboards Award.
Oh, yeah.
The Billboard Awards, yeah.
Yes, and of course Nas was honored. We saw Lil Wayne being honored, and it's such a great. Ice Spice is fresh of breath air.
breath
of fresh air.
Yes.
Yeah, it's a good breath.